If you have ever felt that sudden, sharp twinge in your lower back, or, that dull, nagging ache that just decides to stick around, you are definitely not alone. But what really goes on when you decide, okay, that's it, I'm going to the doctor? Well, today, we're going to pull back the curtain on that exact experience. What to expect when you see your doctor for low back pain.
First off, let's just get a sense of how common this is. Check this out. Up to 80% of adults will have low back pain at some point in their lives. That is a huge number. It's one of the main reasons people go to the doctor in the first place, which is exactly why knowing what to expect can make such a big difference.
So to really bring this to life, let's follow two different people with two very different stories. First, meet Mr. Jones. He's 46, and for the past week, he's had this new sharp pain after doing some heavy lifting. And then we have Mrs. Smith. She's 64, and she's been dealing with a dull, nagging backache for about 5 months now. As you're about to see, their journeys are going to look quite different.
All right, so the very first thing that happens, and honestly the most important part, is just you talking. The story you tell your doctor, when it started, what it feels like, that is the foundation for everything that follows. And they aren't just listening, they are actively hunting for very specific clues in your story.
So, as you're describing your pain, what's really going through your doctor's head? What is their number one absolute top priority in those first few minutes? Well, it might surprise you. It's actually not to pinpoint the exact muscle or disc that's causing the problem. Nope, it's something way more critical.
And here it is. The first thing they have to do is rule out the rare but really serious conditions. Think of it like a safety check. Before they can figure out the nuts and bolts of your ache, they have to make sure there isn't a 5-alarm fire hiding somewhere in the background. And these are the so-called red flags they're listening for. Basically, the spine's smoke alarms. We're talking about very specific things, like any new trouble with bowel or bladder control, a personal history of cancer, losing weight when you're not trying to, or a major injury like a car crash. If any one of these pops up, it immediately changes the entire direction of the visit.
Now, your doctor is also listening for something else, what we call yellow flags. Now, these aren't about life-threatening conditions, but they are super important. These are things like depression, anxiety, or a really strong fear that any movement is just going to cause more damage. And these yellow flags, they are powerful predictors of who might go on to develop long-term chronic pain.
Okay, so once the doctor has your story and they feel confident there are no immediate dangers, the detective work continues with the physical exam. This is where they start gathering physical clues to match up with the story you've told them.
So what does this exam actually look like? Well, it usually comes down to 4 main parts. First, they'll just look at your back, the skin, the curve of your spine. Then, they'll use their hands to gently press on different muscles and bones. After that, they'll ask you to move a bit, bend forward, twist side to side, to check your range of motion. And finally, they'll do a few simple neurologic tests to check your strength, feeling, and reflexes.
Now, one of the most common tests you'll see, especially for someone like Mr. Jones who has that pain shooting down his leg, is the straight leg raise test. It's a really simple but incredibly informative test for any kind of nerve irritation.
And here is the absolute key to this test. What makes it positive? It's not just feeling any pain. A truly positive test is when that sharp, almost electric pain shoots all the way down your leg past your knee. That specific symptom is a classic sign that a nerve root in your lower back is getting pinched or irritated.
So after the conversation and the physical exam, we come to a huge crossroads. And it's the question that's on pretty much every patient's mind. So, do I need an X-ray or an MRI? And the answer is probably not what you think it is.
Let's just ask it directly. For acute back pain, like what Mr. Jones has, and with none of those red flags we talked about, should you be getting an MRI right away?
57%. This number right here is at the very heart of why doctors are so cautious about ordering imaging tests right away. So what does it mean?
And here's the kicker. That 57% comes from a famous study that found that more than half of adults over 60 who had absolutely zero back pain still had things like disc bulges show up on their MRI scans. These are often just normal age-related changes, kind of like getting gray hair but on the inside. So you can see how imaging too early might lead to a lot of unnecessary worry over things that aren't even causing the pain.
So the guidelines are actually pretty clear. You get imaging immediately if any of those red flags pop up. You might get imaging after 4 to 6 weeks if things just aren't getting better. But for the vast majority of straightforward acute back pain cases, it's just not indicated.
Okay, so the evaluation is done. What's next?
Well, now we move on to the path to recovery. And this is where the stories of Mr. Jones and Mrs. Smith really start to go in different directions. Because the game plan for new, acute pain is very different from the approach for long-term, chronic pain.
And this is such a critical distinction to understand. For acute pain, the main goal is to manage the discomfort and keep you moving while your body does its thing and heals itself. But for chronic pain, the goal totally shifts. It becomes less about getting the pain to zero and much more about improving your ability to do things and just enhancing your overall quality of life.
Now, when we look at the evidence for what helps acute pain, there are a few surprises. What's the number one thing you can do? Stay active. Seriously, it's proven to be way better than bed rest. A little heat can help too. Things like massage might offer a small benefit. But what's really interesting is that for simple, acute back pain, starting a formal exercise therapy program right away doesn't really seem to change the outcome much.
For chronic pain like Mrs. Smith has, the toolbox gets a whole lot bigger. Here we see things like yoga and Tai Chi showing moderate benefits for both pain and function. And, so importantly, therapies that focus on the mind-body connections start to play a huge role. We're talking about things like cognitive behavioral therapy, or CBT, which helps you change your thoughts about pain, and also mindfulness practices. It's really about finding the right mix that works for you.
So, what about medications for chronic pain? Well, the evidence shows that while some can help, most only offer a small to moderate amount of relief. Anti-inflammatories, that's your basic over-the-counter stuff like ibuprofen, are usually the first line. Other meds might be added if those don't work. But it's really important to see that even powerful prescription drugs, like opioids, have been shown to have only a small effect on long-term chronic pain.
So, after all of this, what is the one big takeaway? It's this. Whether your pain is brand new or you've been living with it for years, the true goal of any good treatment plan isn't just to make the pain number go down. It's to help you get back to doing the things you love and need to do. It is all about function.
And that leaves us with one last question for you to think about. The next time you talk to a doctor about pain, ask yourself this. Is our plan focused on improving what I can do? My ability to walk, to work, to play with my kids? Or are we just chasing a pain score of 0? Because reframing that goal, well, that's often the most powerful step you can take toward truly feeling better.